FM, the Health and Wealth Radio Network. Don't miss Community Conversations with Tanoa Linpoye, Fridays at 5 p.m. WNN.
If you've decided to get back to feeling good again like you used to feel, then you're invited to tune in to the Dr. Bob Martin Show. Hi, I'm Dr. Bob, at your service Sunday mornings at 10 on Talk 1470 WNN.
If you suffer from excruciating back pain, do not have surgery. Call Dr. Fernando Ranella, MD, and ask him about the new ozone therapy and how it can eliminate your back pain once and for all. End your suffering today. Call Dr. Fernando Ranella, the Center for Back Pain Management, 561-819-6325. That's 561-819-6325 or injectpainaway.com.
Now you can get Talk 1470 WNN on 95.3 FM too. Loud and clear, Health and Wealth Radio, WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. We have a very packed program tonight. We're going to be talking about a skincare line with a plastic surgeon to start the program, and in the second half, we have a nephrologist, and we're going to talk about kidney care. So really covering the healthcare and skincare lines, the latest and greatest in South Florida tonight. But before we get started, I want to tell you a little about All County Healthcare. They're our sponsor. They're a Medicare certified home health care agency. If you have any questions about home health or Medicare, you can ask them questions at 1-888-717-7170. Ask for Maddie. She will be happy to answer all your questions. Or like I do, I go to allcountyhealthcare.com or their Facebook page, All County Healthcare INC. You just put that in the search bar, and that's where you can see videos of this show anytime, as well as the website. And then you can, if you ever want to look back for some information, we've had a lot of orthopedic surgeons on here, cardiologists, neurologists, plastic surgeons. Tonight will be our first nephrologist. So we have a library of health there for you to check out if you ever want to have do a little research for you or your family on health in South Florida. So without further ado, I want to welcome Dr. Hilton Becker back to the program. He's a plastic surgeon, Clinic of Plastic Surgery right here in Boca Raton. Dr. Becker, how are you?
Very well, thank you.
Thank you, and thank you for coming back to the program, and we really appreciate it. And we're going to talk a little bit. We're going to flip do a 360 from last time we had you on. We talked about the latest and greatest in plastic surgery, but you have a skincare line. And it's not unique for doctors to have a skincare line, maybe in dermatology or plastic surgery, but your focus is on all natural, the best ingredients. So tell us a little bit about your skincare line, and then I have a couple questions for you as well.
Well, if you look at skincare generally, it's mass-produced, and most of it is made with chemicals that are made to look good, feel good, and smell good. Little effort is put into efficacy or studies, etc. So when I started plastic surgery, we were doing skin peels, and one of my patients who had a skin peel came in a few days later with a terrible rash on her face. And I said, what happened? She said, oh, I put a moisturizer on, and after that my face just swelled. So I said, what moisturizer was it? And she told me the name. She actually had the bottle with her. I picked up the bottle and read the ingredients, and I was quite shocked because I'd never done that before. And having a background in chemistry, I recognized there were a lot of chemicals in there, and a lot of them quite toxic. So I looked into this, and I decided I need to get something better for my patients. So I started bottling very simple products such as olive oil, and then we progressed to squalene oil, and then we went on to a 100% natural exfoliant, which is glycolic acid. And this just grew and grew based on 100% natural ingredients. We bottled single ingredients that really had an effect on the skin. Now, if you look at skincare products, a lot of them claim to be natural, but actually they're not, because most skincare products are either lotions or creams. And in order to make a lotion or cream, you have to dissolve oil in water. And to dissolve oil in water, you need an emulsifier. Once you've formed a cream, it's an ideal culture medium for bacteria. So you've got to add preservatives. And so the list of chemicals go on and on. So we decided to make a product chemical-free that would not irritate the skin and would be 100% natural.
Oh, that's fantastic. And you obviously put a lot of research in from your chemistry background as well. And that's huge as well. And I can tell you, as someone who had acne at a very early age, I mean, there's definitely stuff out there that will rip apart your dermis, your skin there. Absolutely. So that's definitely great to hear that. And you kind of talked about it on your website as an opposite approach. I like that term because that was kind of unique, and that's where that kind of I kind of noticed that right away. And that's because it's a product free from a concoction of the chemicals you were talking about with little or no scientific basis, which you just hit on as well, or harmful. And then you're introducing a program without harmful effects, and that is effective active ingredients, which are natural. So one of those active ingredients is, and I'll probably get this wrong, but salicylic acid. What is that, and how does that work to open the pores or pore cleanser, I guess?
Well, salicylic acid is one of the hydroxy acids that we use. Salicylic acid is derived from willow bark, so it's a fairly natural substance. The other exfoliants are lactic acid, which is the mildest one, glycolic acid, which is sort of in between, and salicylic acid is a more aggressive exfoliant. It's used for acne skin, it absorbs oil, and used to dry, oily skin.
Okay. So acne can happen at all ages, but we normally think about it in adolescents or teenagers. Do you treat patients that young, or do you also treat adult acne as well? How does that work?
I don't really treat acne as such. I'm not a dermatologist. But, just for normal skincare, when the patients come in with oily skin, we give them salicylic acid. Patients with acne really should be treated by a dermatologist. There are a lot of strong new medications that they use today that need supervision of a dermatologist.
Oh, okay.
Right.
But the salicylic acid is something that can maybe help as a pore cleanser for adults that are already seeing you in your practice.
Right.
For other ailments or procedures.
Right. So the salicylic acid is not put into a base or a cream or a lotion. It is the pure 100% salicylic acid. The same if we use glycolic acid. It's pure glycolic acid dissolved in water. We do not put it into any fancy ingredient that smells good, looks good, or feels good. We want the active product.
So there's not a lot of fillers as well.
Nothing, yeah.
And not a lot of fake ingredients, like you said, to make it smell or you know, be more appealing.
Correct.
I guess is the word.
Great.
So you're getting the honest truth, exactly chemicals, the healthy stuff that right from nature.
Correct.
Okay. Now, one of the other things I saw on the website as well was essential lipids moisturizer. And I think of lipids, that's a fat, right?
Lipids are the fats and the oils that the skin naturally produces. So as we age, we lose lipids on the skin. One of the main ingredients in the skin is sebum, and sebum is a mixture of lipids and squalane oil. Now, you can get squalane oil, 100% pure squalane oil, and apply that to the skin, which is an excellent moisturizer, prevents water loss from the skin. But a lot of creams are actually squalane oil taken in small quantities, mixed with water, with emulsifiers and chemicals, and you really don't want that. If you're going to use a moisturizer, use pure squalane oil. Now, a lot of women don't like to put oil on their skin. It's not glamorous, it's not sexy. So they buy a beautiful smelling cream that has the emulsifiers and the chemicals in it. You're far better off just using very light oil, applying it to the skin, and letting it dissolve into the skin instead of using a rich cream. Now, what we've done as well, we've combined our squalane oil with hyaluronic acid, which is a substance that I've done research on actually and shown that hyaluronic acid stimulates collagen formation in the skin. Now, hyaluronic acid is a very expensive active ingredient. It's added to a lot of skincare products in very small quantities just so that they can put on the label contains hyaluronic acid. So my philosophy, once again, is if you're going to use hyaluronic acid, use 100% pure hyaluronic acid. The problem is if you dissolve hyaluronic acid, it comes as a powder. If you dissolve it in water, you've got to add preservatives once again. So what we do is we dissolve the hyaluronic acid in the squalane oil. So now you've got two active natural ingredients. You apply it in the palm of your hand, add some water, which will now dissolve the hyaluronic acid, mixed with the squalane oil, and you have the perfect moisturizer.
Does that take some people a little bit of getting used to because they're used to the thick cream and that they've kind of been brought up on?
Absolutely, and that is the problem. Patients don't want to have to do any work. They want to put their finger in, pull out a very romantic cream and apply it to their face and think it's magic. Now, this product, as I said, the powder is dissolved in oil. So before you use it, you've got to shake it up to suspend it because there are no emulsifiers in there. Once it's in the palm of your hand, you've got to add water. So you've got to do a little work to get this moisturizer. But once you get it, it is par excellence, the best moisturizer you can find.
And that's when they notice that they've got something that it's worth making the change to.
And is different to your standard moisturizer, correct.
Now, your line of moisturizers here and the pore cleanser, is do you have to be a patient of yours? Or
No, you can get it from our office, and it's also available online.
Okay.
You can go to my website, www.beckermd.com, and it's all available there.
That's where I am right now, and there's a ton of info there. Now, that's where I also found a little bit of information about vitamin C serum. I had never heard about that before. Of course, we think of taking vitamin C, especially this time of the year with all these respiratory illnesses and viruses and bugs going around. And as men and women, adults taking vitamin C, but there's actually a vitamin C serum that can help the skin.
Absolutely, and very interesting. Vitamin C has been shown to be very effective in the skin. It's an antioxidant, and it stimulates collagen formation. However, once again, vitamin C comes in a powder, and if you dissolve the powder in water, it will break down very rapidly. So companies have used very expensive substances to try to stabilize the vitamin C. And the vitamin C lotions and creams can be very, very expensive because of these stabilizers to prevent the vitamin C breaking down. But vitamin C as a powder is very stable. So you don't have to suspend it until you apply it onto the skin. So we actually now have gone to powders, and a few other companies have now gone to powders that they sell that you can apply to your skin and add water just prior to adding the powder to your skin. You get a far higher concentration. So we have little 1 ounce jars of pure vitamin C powder that you can add with your moisturizer. So you can blend it yourself and decide how much you want to put on. The same applies to sunscreens. Sunscreens are made out of a lot of toxic chemicals. The best way to prevent sunburn is to use a sun blocker rather than a screen. A sunscreen absorbs UV light. A blocker prevents it getting in. So what is a blocker? Zinc oxide. It is a white powder. But of course, you put it on your skin, you're going to be white. But that is the best way to prevent sunburn. So we sell zinc oxide powder that you can blend with your moisturizer and decide how much protection you want. If you want real heavy-duty protection, you're going out fishing and you don't want to get burnt, you mix a white powder and apply it to your face. If you just want everyday protection, just add a small amount of zinc oxide to your moisturizer, and that will protect you from just walking around in the street, the scattered UV rays.
Which is important all times of the year here in South Florida, because a day like today without, much cloud cover, I've even heard people getting actually skin cancer, driver's side melanoma. We've talked about a few times in this program, from taking the sun in the morning every day on the same side.
Correct.
Up to, I've heard a lot of different stories. But hold that thought, Dr. Becker. We're going to take a quick break, and on the other side, I want to talk to you a little bit more about sunscreen. I love the name of your sunscreen, Natural Protective Butter Sunscreen, on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Where's the strawberry farm?
That's fantastic. And we're back on the You and Your Doctor show, where we're here with Dr. Hilton Becker. He's a plastic surgeon, Clinic of Plastic Surgery right here in Boca Raton. But we're talking a little bit about Becker MD Naturals line of skincare products. And we're going to talk a little bit of plastic surgery right towards the end here in about 5 minutes. So if you have any questions, I have Dr. Becker here till just about 6:30, 1-888-565-1470. Before we broke with the break, I had mentioned that I really like the name of the sunscreen that you put out, the Natural Protective Butter Sunscreen. And I think that's great to, be able to get sunscreen from a doctor. I mean, rather than just going to the, the drugstore, this is something that was researched by a physician. And you were telling me during the break, all of your products, you work with your brother, and he's the distributor.
Correct.
So that's really neat. And I had mentioned that when I was on your website, beckermd.com, if you click on skincare there, the prices of everything that we've talked about were, I thought, pretty low coming from a doctor. And I'm not meaning because doctors charge high prices or anything. What I mean is all the education and training that you have and the research that you put into this product. So how were you able to keep the prices so low?
Well, a lot of commercial products, the major cost goes into the packaging, the marketing, and the advertising, and the third parties involved. With me, it's direct from the manufacturer to me. Very little money is put into the packaging and the marketing. So most of the cost is involved in the actual ingredients, and the ingredients are the natural, super active ingredients.
And that cuts down on the cost. That's great.
Yeah.
Can you only get Becker MD natural products either at your office or if you order them online, they're not available like at, say, Publix or grocery stores?
No.
Okay. That's why. Okay. That's really good to know. Let's talk a little bit about natural exfoliants, because I know you mentioned that a little bit on the website, and I don't really focus on exfoliants, but I'm sure some of my listeners do. So what are they and how do they work?
Well, one of the best ways to rejuvenate your skin is with exfoliants. And if you notice, everything I do with the skincare is keeping it simple. And the simplest way to exfoliate your skin is with a dry brush. Just brushing your skin every day. Because what happens as we age, the rate of exfoliation, that is the cells move to the surface of the skin and then they shed. And as this process of shedding slows down, our skin dries, you get flaky, crusty lesions on the skin. And if you don't speed that process up, your skin is going to age and look old. So the way to speed it up is to dry brush your skin for a start. Now we have exfoliants which loosen the dead cells that are attached to the skin. And these are alpha hydroxy acids. They're naturally sourced. There's lactic acid, which comes from milk. There's glycolic acid, which comes from sugarcane. So these acids, once again, they're 100% natural. We apply them to a gauze sponge after dry brushing. Apply to a gauze sponge and just rub it on your skin. You don't need soap. You don't need cleansers. Just clean your face with the acid and then wash it off. Then your skin is ready for moisturization. And anything you apply to your skin after dry brushing and exfoliating is going to penetrate the skin easier. So your moisturizer with your vitamin C and the other active ingredients that we have in our moisturizer will penetrate the skin better.
And you mentioned it before, if you take the time to do these steps, you're going to get a far better outcome than maybe what you're used to in the commercial world.
Absolutely.
And I like that also on your website, there's a ton of information, but I keep on saying the website because, I'm really fascinated with how much information's on there. But you have a Dr. Becker's Basic Skincare Regimen on there, and it is very thorough. It's something that people can print out and learn a little bit more about everything we talked about today. So definitely check that out, beckermd.com. Dr. Becker, where is your office in Boca Raton?
I'm right here on Glades Road, across the road to FAU, next to Boca Regional Hospital.
Okay, wow, that is right around the corner. Mm-hmm. That is a great area, too, as well. I actually went to FAU, so go Owls. Really neat there. Mm-hmm. And the phone number I have here, I'll let you give it out.
561-394-6656.
Okay. And it's beckermd.com/skincare for the skincare service line. Now, your education and training is in plastic surgery.
Correct.
So what is the latest and greatest in plastic surgery that you're offering here in Boca Raton?
Well, there's several interesting things that we're doing. I'm actually on the faculty at FAU as well, the medical school.
Great medical school that they've built there in the last
excellent
10 years.
We have residents and students working with us. So I'm actually doing some research on stem cells that are derived from fat. And we can harvest fat from one part of the body and inject it into another part of the body. We use it to help with our breast reconstructions after breast cancer, and also to rejuvenate the face, to fill in the face. With a lot of women, instead of doing a facelift, we can rejuvenate the face by adding more fat, taking out the sunken look on the face, filling in hollows, for example, under the eyes, the temples, and the cheeks. So fat injection is a very exciting area. The other thing that we are doing in terms of breast lifting, we have techniques now where we can do a breast lift with virtually no visible scarring. The scar is placed around the areola where it's hidden, and we use an internal mesh support to hold the breast up. This all stems from breast reconstruction work, which I'm involved with, and today a woman can have a mastectomy with an immediate reconstruction where the scar is not visible. The scar is placed in the fold of the breast, and she can look like she's never had a mastectomy or a reconstruction. She can look virtually normal. So that's another very exciting area. Being involved in that area, also doing a lot of breast implant problems. Patients that have had breast implants many years ago now don't want them anymore. The implants may be ruptured. They may have scar tissue around the implants. We take them out and we reshape the breast so that they don't have a sagging breast after taking an implant out. We can restructure the breast and get it looking far more normal. Also, in the past, implants were placed underneath the muscle. And many surgeons still place the implants under the muscle. But what happens when you have an implant under the muscle, you get a deformity known as animation deformity. When you contract the muscle, the breast implant distorts out to the side. So we're doing a lot of patients that have had this in the past. We take the implant out from under the muscle, put it above the muscle, and they now look far more normal.
So between the muscle and the skin then?
Correct. But
Wow.
it's not actually under the skin, it's under what's called the fascia,
Okay.
which is the lining of the muscle. In the past, they would put it under the skin, but that didn't have enough support for the implant. So raising the muscle, the lining of the muscle, the fascia, that membrane holds the implant in position so it doesn't sag as much as it used to.
Wow, that's fascinating how it's changed so much, and your experience is a test to that. Obviously, you've been in the field a long time, and you're able to take the best, what's best for the patient, and offer it to your patients. You kind of mentioned there a little bit before. I know we just have a couple more minutes, and one of the questions I had, starting with the fat used as a filler, and this is for I imagine women who are a little bit older, who over time the face begins to kind of, you said sunken because of age. Is that why?
Correct.
And now, is this fat taken from the midsection, and if so, is it substantially enough to make a difference in the look, or no? I have to ask that.
Right. No, the fat can be taken from anywhere.
Okay.
It depends how much we're going to inject. If we're going to use it to reconstruct a breast, we can take a lot so that it really looks like the patient's had liposuction. But if the patient wants a filler, instead of using a synthetic filler, we can actually take the fat, we can concentrate it, we can actually extract collagen from the fat, and we can inject like 1 cc at a time into the nasolabial folds. We can inject the lips, fill the lips, or we can do the whole face where we can plump up the whole face. So there we could take like the whole of the lower abdomen and utilize that fat.
And that's fat from their body rather than a synthetic.
Correct.
Really, that's really neat. Another question I had, you mentioned about the for women who had mastectomy, and then there's sometimes the option for an immediate reconstruction, meaning the general surgeon walks out and you walk in, or you're already right there?
Right, exactly. As soon as the surgeon's done with the mastectomy, I'm there doing the reconstruction right away. It only takes another 35, 40 minutes to do the reconstruction. The patient leaves hospital with a virtually normal looking breast.
That is amazing.
Because the surgeons today are no longer doing the old-fashioned mastectomies. They are saving all the skin, including the nipple. So when the surgeon's done, he's basically removed the breast gland, leaving the skin behind, we then reconstruct with an implant. The various types of implants we use. I like to use the adjustable implant where we can change the size after surgery and get the woman looking as good, if not better, than before the mastectomy.
Yeah, and that does a lot with their outcome wise for attitude and recovery.
Absolutely. And also their immune system. In the past, when a woman had a breast removed and she was left as what was called a mastectomy cripple, they would get recurrences. The immune system would be shattered. Today, a woman's self-esteem is totally restored. Breast cancer picture is totally different to when I first started plastic surgery.
Wow, that is fascinating. Well, Dr. Becker, I want to thank you so much for coming on the program, talking about Becker MD Naturals, your skincare line. I definitely learned a lot, and everyone should definitely take another look at allcountyhealthcare.com at this video if you missed anything tonight, or the Facebook page as well. And I'm always fascinated with all the different type of procedures you do as well. You can find more info there at beckermd.com. And like Dr. Becker said, he's right here in Boca Raton, actually right across from FAU, right around the corner from actually his radio studio, 670 Glades Road, Suite 220.
220.
Boca Raton, 561-394-6656. Well, Dr. Becker, you're always welcome on the program. Please come back on in the future.
Oh, well, thank you.
Let us know when you want to share any other information. We'll be glad to have you on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome to the second half of the program. We're going to be talking nephrology. I've actually never had a nephrologist on the program. I've actually only met one in my 4.5 years healthcare, so I'm really excited to bring the latest in kidney care and everything else that involves nephrology. So we're going to learn a lot about it. We're here with Dr. Allie Nair. Miami Renal Institute made the drive up from Miami to here to Boca Raton. Dr. Nair, welcome to the program, and thanks for making the drive.
Thank you. It's my pleasure to be here today.
I really appreciate it. And like I said, you're the first nephrologist I had in the program, 2 years of doing this, so I really wanted to have a nephrologist on. And diabetes has been a huge topic on this program. We have a lot of cardiologists on the program, a lot of internists as well. Can diabetes affect the kidney? And if so, how does it affect the kidneys?
Well, this is a very good question, especially because diabetes, as you said, has become so prevalent in the U.S. There are millions of people who have diabetes, and sooner or later, a proportion of those patients will end up with what we call microvascular complications of diabetes. These are the small blood vessel disease as a consequence of diabetes that affects both type 1 and type 2 diabetics. And these are nerve damage, eye disease, retinal problems, as well as the kidney problems. And it has all to do with the blood vessels in the kidneys, because kidneys, as you know, filter the blood, and there are tremendous number of small blood vessels in the kidneys. So when the blood sugar is high as a consequence of diabetes, high blood sugar changes the physiology of small blood vessels and causes damage second by second, day by day, so that after 10, 15 years, the kidneys start failing. But the situation with diabetes is a little complicated because a lot of people have diabetes, but only a subset of patients with diabetes develop kidney problems. So there are genetic factors that then dictate which diabetic is going to end up with kidney failure. So a family history is very important. If the father or mother had diabetes and ended up on dialysis, this is usually a poor prognostic indicators. So for diabetic kidney disease, to make a long story short, both the environmental factors, the diet, exercise, as well as the genetic factors are important.
We hear that a lot on this program, genetic factors, more so every single day in family history. So that is so important. But as you mentioned as well, staying healthy, not being overweight, can also help as well. Now, I know high blood pressure is associated a lot of times, unfortunately, with diabetes as well. How does high blood pressure affect the kidneys?
That's a very good question. You see, the blood vessels are like little tubes, and if the pressure inside these tubes is high, obviously there's going to be a lot of shear stress on the wall of this tube. And the blood vessels, in contrast to a solid tube, there are live cells made up of live cells. And once you have, over a prolonged period of time, increased pressure on top of these cells that do a lot of different things in maintaining the blood flow and so on and so forth, then they become damaged, injured, and as a consequence, there would be narrowing of the blood vessels and problems with the blood flow through those blood vessels. And this is, for example, what we see in a patient who develops stroke as a consequence of narrowing of a blood vessel in the brain. And the narrowing is sometimes the result of long-standing high blood pressure, which people may or may not know about it. Because as you know, high blood pressure is a silent killer. So is the kidney disease. A lot of people don't notice anything until, unfortunately, it's very late in the process of the disease.
Yeah, when everything is working, perfectly in the system, and you're not going to really notice anything. But when they start throwing in diabetes and high blood pressure, it's almost like the body, unfortunately, is kind of attacking itself in a way.
That's very true.
Well,
yes.
And systems are starting to shut down. Unfortunately, you obviously can't live without your kidneys, and the blood needs to pump through there. Now, does nutrition play a role in kidney care? If I'm a very healthy eater, is that going to help or not?
Absolutely.
I'm not saying that I am. We see me but I'm trying to be.
I
look like you are, though.
The nutrition has a profound impact on overall health, as well as on individual organ health, cardiac health, kidney health, and so on and so forth. So a diet that is loaded with salt, for example, is not good for kidney function, is not good for blood pressure, because high salt intake increases blood pressure. And if the blood pressure is high, we have high blood pressure or hypertension, and then causes damage to the organs, to the heart, to the kidneys, to the brain, and so on and so forth. A diet that is loaded with saturated fats and trans fats are not very healthy. Because again, the cells take up this fat and they have difficulty metabolizing these types of fats. And as byproduct of metabolism of these kind of fats, you have toxic substances that accumulate inside the cells and cause cell toxicity. So those types of lipids, fats are not very healthy. So these are very important factors in kidney health, cardiac health. A diet that has good type of fats, and these are Mediterranean fats, such as olive oil, for example, fats that have a lot of unsaturated fatty acids, fat that is coming from grains, for example, from walnut or almonds, and so on and so forth. They're supposed to be healthy fat. And also anti-inflammatory fats. They have anti-inflammatory properties, and we know how important inflammation is in the pathogenesis of diseases, how the diseases come about. Not only the modern diseases such as cardiovascular disease, but accumulating evidence shows that inflammation plays a role in the process of carcinogenesis. When people develop different types of cancers, inflammation is part of that process, and inflammation appears to promote cancer cell growth. And the dominant example is breast cancer, and so on and so forth in women. So diet is very important, and physical activity is super important. There was an investigator from Europe that gave a talk at the University of Miami, where I used to be a faculty, about the muscle activity and muscle contraction that results in release of over 1,000 mediators from the muscle cells that would promote health. These mediators are going to improve insulin sensitivity and reduce diabetes risk. And these are obviously a lot of endorphins that are going to make us feel better after exercise, but a whole slew of positive metabolic effect in the body. So that's another thing, exercise. Even if it's mild exercise, is for sure better than no exercise. Obviously, the ideal thing is if for somebody who has the physical ability to do that, to do 40 minutes exercise 3 times a week. Even that small amount of exercise, relatively speaking, has profound effect on our health.
That's great to hear. And we're here with Dr. Ali Nair from the Miami Renal Institute, 2040 Northeast 163rd Street, Suite 204, North Miami Beach. Great website, drnair.com. Just going to put in the browser www.drnayer.com. The phone number is 305-615-1514. And we're learning a lot about nephrology tonight, and also obviously that encompasses the kidney care as well. Now, I was going to ask you about dialysis. I kind of jumped around because I went on your website and took everything. But let me ask you first, what is the size of an adult kidney? Because I think to understand this for the general person doesn't have the education and training. Right. What is you've seen one? What's the size of it?
It's just the size of a fist, actually.
Really?
If you make a fist, so your fist would be roughly the size of a kidney.
Okay.
And
now, if you're a smaller sized person, would it be smaller?
Would be smaller. Obviously, the fist would be smaller too. If you are bigger and you have larger fists.
So these are the sides of my kidneys. That's true.
Right. And with the size of the kidneys, obviously has to do with how tall we are and what's our body mass, and whether whether what we eat and whether we are overweight. So there are a number of factors. But as a rough estimate, the size of a fist would be the size of the kidney.
Now, it can become, obviously, if you're bigger, it can become inflamed. But also, if there's a problem with it, it gets smaller and shriveled up. Have
point,
I
David.
heard that?
Absolutely. For example, with certain condition, for example, I think good example would be if somebody would donate a kidney, because there's always concern what happens to me if I donate a kidney. Kidneys have a remarkable ability to adapt to the new condition, meaning that if one kidney is removed, the other kidney is going to work harder and is going to grow to compensate for the lost kidney. In each kidney, we have roughly 1 million tiny filters. And once a kidney is gone, the other kidney, the filters become stronger, larger, and they would filter more blood, clean more blood, so that overall kidney function as a whole remains more or less the same. So kidneys have a lot of stem cells that allow the kidneys to adapt to the new environment, physiological or abnormal environments. On the other hand, if you have a disease that kills the little filters, such as high blood pressure for many, many years, destroys the tiny filters, there is a process of scarring going on inside the kidney. And as you know, scars contract. Whenever you have a cut, you see that some years later, that area is contracted. The same process happens in the kidneys. Once there are scars, little by little over many years, the kidneys tend to contract and become smaller. And when I have a patient that I see in consultation for the first time, and I don't know how long he or she had kidney disease, one clue would be doing the kidney ultrasound to measure the length of the kidney. And if the kidney is already shrunken and small, it would give me very valuable information that the kidney disease has been going on probably for many years that resulted in a shrunken, scarred kidneys. And once there is a scar doesn't go away easily. And the same way with the kidneys. Once you develop these scars in the kidney, they stay there and they never go away. So that's the importance of prevention. If you're diagnosed with diabetes, you got to take good care of yourself. If you're diagnosed with high blood pressure, you got to take good care of yourself, because you don't want to get into the situation where you end up with a scarred kidney.
I see. Dr. Nair, hold that thought. We're going to take our last break, and on the other side, I'm going to ask you a little bit about the Miami Renal Institute. I know you have a great team over there on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Health Care. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond. I say beyond because we're heard globally, around the globe with Facebook Live and iHeartRadio apps, and right here in South Florida. We're here with Dr. Ali Nair, Miami Renal Institute. He's a nephrologist, so he specializes in kidney care. Miami Renal Institute, like I said, great website, drnair.com. That's NAYER.com. You've got quite a team at the Miami Renal Institute. I was very surprised. I knew you're a very prestigious physician, but the amount of doctors that you have at the Renal Institute and their specialties is just amazing. Can you talk a little bit about your team?
Sure, David. Kidneys are very complex organs, and once there is kidney problem, you have to approach it from all different sides. We talked about nutrition, the importance of nutrition in kidney health and overall health. So it would be important for my patients to see a nutritionist who specializes in patients with kidney disease, so they get educated about what is good for them, what is bad for them. Just to give you an example, if somebody has chronic kidney disease or slow kidney function, meat would not be a great thing for them, because meat somehow increases the pressure on top of the little filters in the kidneys. And if they're already working very hard and they're overworked and you increase the pressure on top of the filters, they're going to go down sooner or later. So we then advise them they need to follow a low-protein diet to preserve kidney function so that the kidneys would last for them for a long time to come. We have social workers, and this is very
saw that.
Yes.
That's great.
This is very important for people who unfortunately have advanced kidney disease or kidney failure, and sooner or later would require dialysis. Dialysis is a very expensive procedure, so they need to be prepared for that. The government has provisions for dialysis patients. If somebody has worked enough through his or her lifetime and has enough credit, they would automatically be eligible for Medicare. So Medicare would pay for dialysis services. But patients who have private insurance, they do not need to leave private insurance to enroll in Medicare, because sometimes private insurance offers more benefits to them once they have kidney failure. So as you see, the economy of kidney failure is very complex, and it goes beyond even a nephrologist like myself who has been in practice for 20 years, especially in the light of ever-changing policies and healthcare insurance situations, so on and so forth.
Here in the U.S.
Here in the U.S. So for that matter, having a so-called renal social worker, this is a social worker specialized in patients with kidney disease and insurances and Medicare and so on and so forth, it would be very important. So most of my patients would appreciate having a conversation with a social worker to learn more about their options. We have been very fortunate to work with a renowned kidney pathologist, Dr. Thomas, who is at the University of Miami. He has been examining kidney biopsies for many years, and he is a world expert. So I'm honored to work with him, and the importance of this is that sometimes, a lot of times actually, we don't know exactly what's going on inside the kidneys. We see that the kidneys are failing, but we don't have a good explanation for it. So it would be very important to take a very tiny sample of the kidney using a small needle, so that we can examine it under the microscope to see what is going on, whether there's inflammation in the kidney, if there is inflammation, what type of inflammation, because this is going to tell us how to treat the kidney problem.
Most definitely.
And if done in expert hands, we have saved a lot of kidneys over the past couple of decades. People who were like almost on dialysis. We have had patients who were on dialysis actually because of an inflammatory kidney disease. We made the diagnosis, we put them on the right medications, and they came off of dialysis.
Wow.
So the importance of a kidney biopsy, examining a small sample of kidney tissue, is cannot be overstated. And it's not for everybody. If somebody has, for example, high blood pressure for 30 years, blood pressure is running 200 over 110, and there is no evidence on examination of urine that there is an inflammatory reaction in the kidneys, we don't do kidney biopsies. But again, in selected cases, it's very important to do a kidney biopsy. It's not only a kidney saver, it could be a life saver. Because remember, sometimes kidney disease is a part of a global disease, an autoimmune process, for example. Young ladies in South Florida who have lupus for one reason or another, they're at risk for kidney disease. And if you diagnose lupus on a kidney biopsy, sometimes you can treat the kidney together with the whole person at the same time. So it's important in some cases to have a kidney biopsy and examine it under the microscope.
Now we're here with Dr. Ali Nair at Miami Renal Institute, drnair.com. I wanted to ask you, where is the kidney located in the body? I think I have an idea, but...
Very good question, actually.
You know better than anyone else.
Yes. Well, let me just turn off my...
Oh, that's fine. We have doctors on the show all the time. Right. You're a busy man. So, it adds for the ambient sound.
So the kidneys are actually in the flank area, right behind your sides, toward the back. And if there is an inflammation in the kidney, sometimes patients report that they have flank pain. It could be one side or both sides, depending whether one side is affected by an infection, for example, pyelonephritis, or whether there is involvement of both kidneys. Sometimes the pain can actually radiate toward the front part of the belly into the groins, and this is a so-called kidney colic that patients, for example, with kidney stones would experience. As the stone is coming down from the kidneys, going to the bladder, causes a pain that will radiate from the flanks into the groins. So that is another type of kidney pain that we sometimes see.
Well, it's hard to believe we only have 2 minutes left, so let's go into the speed round.
Right.
Is drinking cranberry juice really good for the kidneys?
It's good for the kidneys. Any type of fluids in South Florida, especially in South Florida, because we are dealing with warm climate, hot climate, and dehydration. So the kidney is like a coffee filter that needs to be washed constantly in order to maintain its function. The kidneys needs to be constantly washed. So ample fluids are very important. Cranberry juice is especially important because it tends to inhibit bacteria from sticking to the bladder wall, especially in a young woman or middle-aged one who gets urinary tract infections. Cranberry would be useful because it can prevent infections, bladder infections.
So it's the real deal.
But go with the low sugar cranberry juice.
Low sugar, of course. Obviously, drink a lot of water. South Florida.
Important. Absolutely.
The music's playing, but we have just under a minute. Does coffee consumption affect the kidneys? You obviously said if it's filtered, can be good, but don't add a lot of sugar and
that's very true.
To it as well.
The thing with the coffee is it's a mild diuretic, makes you pee, obviously. You drink coffee, and if you're dehydrated, you drink coffee, and you get more dehydrated because you go to the bathroom to urinate. That is not good. So that's why in Europe, they serve coffee with a glass of water at the same time.
I actually already do that, so I'm good there. Dr. Nair, thank you so much for explaining so much about nephrology. We got to have you on again on the You and Your Doctor show.
Appreciate that. It was a pleasure. Look forward to working with you.
Check them out, drnair.com, N-A-Y-E-R. Thank you, and good night, South Florida.
Have a good night.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed.
Formula G, Mondays at 5 p.m. WNN.
If you're sick and tired of being sick and tired, tune in to the Dr. Bob Martin Show. From erectile dysfunction to eczema, heartburn to headaches, carpal tunnel to how to lower cholesterol drug-free. Sunday mornings at 10. on Talk 1470 WNN.
If you suffer from excruciating back pain, do not have surgery. Call Dr. Fernando Ranella, MD, and ask him about the new ozone therapy and how it can eliminate your back pain once and for all. End your suffering today. Call Dr. Fernando Ranella, the Center for Back Pain Management, 561-819-6325. That's 561-819-6325, or inject pain away.